This phrase sets the tone by emphasizing just how essential and hardworking your liver is. It's not just another organ, it's one of the busiest and most vital organs in the entire body. Calling it a powerhouse suggests strength, productivity, and importance, which helps the viewer immediately grasp that liver health should be taken seriously, especially in older age. It filters toxins. One of the liver's most crucial jobs is to act as a natural detoxifier. Everything you eat, drink, breathe in, or absorb through your skin eventually passes through your liver. It filters out harmful substances like alcohol, medications, and environmental chemicals, breaking them down so they can safely leave your body. Without this function, toxins would build up and cause serious harm. Processes nutrients. After you digest food, the nutrients go to your liver, where they're converted into usable forms. The liver stores vitamins and minerals, helps manage blood sugar levels by converting glucose to glycogen, and ensures that the rest of your body gets the right nutrients at the right time. It's like the distribution center of your metabolism. Manages cholesterol. The liver produces and regulates cholesterol, which your body uses to build cells and hormones. It creates good cholesterol, HDL, and controls bad cholesterol, LDL. When the liver is stressed or damaged, cholesterol levels can become unbalanced, increasing the risk of heart disease. And supports your immune system. Your liver plays a major role in immune defense. It helps your body recognize and destroy harmful invaders like bacteria and viruses. It also produces proteins that are part of your immune response. In simple terms, a healthy liver means a stronger ability to fight illness. This means that the chemical reactions and functions the liver performs every second, like breaking down food, filtering toxins, and processing medications, start to decline with age. It's a natural part of getting older, similar to how muscles weaken or bones lose density. The liver becomes less active enzymatically, and blood flow to the liver decreases, which further reduces how efficiently it works. This is not usually noticeable day to day, but it becomes a concern when medications are involved. This means the liver isn't able to process substances, especially medications, as quickly or effectively as it did in younger years. When you take any drug, your liver works to break it down so your body can use it or eliminate it. But if your liver is slowing down, that drug may stay in your system longer, potentially building up to dangerous levels. This reduced ability can lead to stronger side effects, toxic buildup, increased risk of liver inflammation or damage. Even standard doses of over-the-counter or prescription medications can become too much for an aging liver to handle if it's not functioning at full capacity. When you take any medication, your liver acts like a processing plant. It uses special proteins called enzymes to chemically alter drugs so they can be either absorbed and used by the body, or broken down and removed through urine or bile. This process is called drug metabolism, and it's crucial for making sure medications don't build up to dangerous levels. But in older adults, these enzyme levels can decline, and blood flow to the liver may decrease. As people age, the production and activity of liver enzymes naturally drops. At the same time, blood flow to the liver decreases, meaning it receives fewer nutrients and oxygen. This two-part slowdown, fewer enzymes and reduced circulation, means the liver just can't work as fast or as thoroughly as it used to when processing medications. This highlights a key consequence of aging: the liver's reduced ability to break down medications quickly and effectively. Because the liver relies on both enzymes and healthy blood flow to process drugs, when both of these decline with age, the entire system slows down. With lower enzyme activity and blood flow, the speed and efficiency of drug metabolism drop. Enzymes act like chemical scissors, cutting down drugs into safe, usable pieces. Blood flow is like a delivery system, helping carry drugs into and out of the liver. When both of these decline, drugs enter the liver slower. The liver takes longer to break them down. The processed waste leaves the liver more slowly. This all leads to a sluggish metabolism of medications, where the liver simply can't keep up like it used to. That means medications stay in their active form longer. When your liver can't break down drugs efficiently, the active ingredients remain in your system for a longer time than intended. This means the drug continues working, even when it should have worn off. The next dose adds to the leftover amount, increasing total levels in the body. This is especially risky for seniors who are on daily medications or multiple prescriptions. which can lead to stronger or prolonged effects even at normal doses. Here's the most dangerous part. Even if you're taking the correct, doctor-recommended dose, the medication can become too strong for your system because it's not clearing fast enough. This increases the risk of drowsiness, confusion, falls, liver toxicity, drug interactions. This is why it's so important for older adults to have their liver health monitored and their medication doses adjusted based on age and liver function. As a result, drugs can stay in the body longer, increasing the chance of side effects or toxicity. Since the liver can't clear medications as quickly, they can build up in the bloodstream. This makes seniors more vulnerable to over-medication, toxic reactions, unintended side effects like confusion, fatigue, or even liver damage. What used to be a safe dose at age 40 might become risky at 70, simply because the body can't clear it the same way anymore. As we age, our bodies change, and what used to be perfectly safe at 40 or 50 might not be as safe at 65 or 70. This part highlights a critical truth: medications don't affect all age groups the same way. This statement draws attention to a crucial fact: age changes how the body handles medicine. A drug that works perfectly fine for a 35-year-old can become dangerous for someone over 60 even if the dose hasn't changed. Why? Because the body, especially the liver and kidneys, naturally becomes less efficient with age. This makes seniors more vulnerable to side effects or harm from medications that were once harmless. This means that a standard adult dose, the same dose written on the label or prescribed by a doctor, may be too much for an aging liver to handle. Medication labels typically assume the user is a healthy adult, often between 18 and 65. But for older adults, the same dosage can be too strong, simply because their bodies can't break down and remove the drug as fast. Even if your doctor prescribed it years ago, your liver's ability to process it may no longer be the same. That's why dosage adjustments are often necessary with age. Why? Because, as mentioned before, liver metabolism slows down, and drug clearance becomes inefficient. As you age, enzymes in the liver decrease. Blood flow to the liver drops. The liver's overall ability to detoxify and filter out medications weakens. So, drugs stay in the bloodstream longer than they should. The medication lingers longer in the system, increasing the risk of buildup and toxicity. Instead of being cleared out after a few hours or a day, the drug hangs around, continuing to act on your body. This leads to drug accumulation, increased side effects, liver overload or toxicity. This is particularly dangerous for daily or long-term medications, or when multiple drugs are taken together. This line emphasizes that common, everyday medications, the kind millions of people take without thinking twice, can become dangerous as we age. Medications like acetaminophen, Tylenol, for pain or fever, ibuprofen, Advil, Motrin, for inflammation, statins for cholesterol control. These are all processed by the liver, and while they may seem harmless, they can stress the liver significantly in older adults. This line shows how even common, everyday medications like acetaminophen, ibuprofen, or statins can become problematic. These are medications that many seniors take daily or frequently, but they all require the liver to break them down, neutralize them, remove their byproducts safely. In younger people, this process is fast and efficient. In seniors, however, it slows down, making the liver more vulnerable to overload and damage, especially when these medications are taken regularly. The liver has to break down these drugs. But if it's already weakened or processing multiple medications, it can easily become overloaded. This is especially true for seniors on multiple prescriptions, a very common situation. The liver isn't just processing one drug, it may be dealing with 5 to 10 different substances every day. This multitasking puts extra strain on liver enzymes and can cause liver inflammation, enzyme imbalances, elevated liver function test results, leading to inflammation, enzyme imbalances, or even liver failure over time. If the liver can't keep up, the damage can be gradual but serious. Inflammation makes the liver more sensitive and less functional. Enzyme imbalances throw off how drugs are processed. And if left unchecked, this can eventually result in severe liver conditions, including toxic hepatitis or liver failure. This risk is often silent. Seniors might not feel symptoms until the liver is already significantly impaired. especially if it's taken daily or in combination with other drugs. Many seniors take multiple medications at once. This is called polypharmacy. The more drugs in your system, the harder your liver has to work. Taking something daily, especially without regular liver monitoring, increases the risk significantly. Even safe drugs can become dangerous when stacked together or taken long-term. It also speaks to a hidden danger. Many seniors aren't aware that their age alone increases the risk of liver stress or injury, and doctors may not always adjust doses unless they're monitoring liver function regularly. That's why knowing what you're taking and how it affects your liver is absolutely essential. Let's start with a big one: acetaminophen, also known as Tylenol. It's in almost every household and often used for joint pain, headaches, or cold symptoms. But taking just slightly over the recommended dose, especially long-term, can lead to serious liver damage. If you're taking multiple medications, check your labels. Acetaminophen is often hidden in cold and flu formulas too. Statins, such as atorvastatin, Lipitor, simvastatin, Zocor, and others, are some of the most widely prescribed medications for managing high cholesterol. They help lower LDL cholesterol, the bad cholesterol, and reduce the risk of heart disease and stroke. However, while statins are effective in their purpose, they come with potential side effects, particularly related to liver health. And while they're effective, they can also elevate liver enzymes, a signal your liver may be under stress. Liver enzymes are proteins that help the liver carry out its vital functions, including detoxification and drug metabolism. When liver enzymes are elevated, it's a sign that the liver is under stress or experiencing inflammation. Statins, despite being beneficial for cholesterol control, can trigger this elevation in liver enzymes. For many, this may be temporary and mild, but for seniors, it can be a sign that the liver is struggling to process the medication properly. For many people, statins are necessary, but your doctor should regularly monitor your liver function. If you're experiencing fatigue, abdominal discomfort, or dark urine, it's time to get tested. NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are widely used for pain relief, reducing fever, and easing inflammation. They're available without a prescription and are commonly used for conditions like arthritis, muscle pain, headaches, back pain. These drugs are effective in treating pain and inflammation quickly, which is why they are so commonly used by people of all ages. But chronic use can inflame and damage the liver, especially in seniors with pre-existing liver conditions. While occasional use of NSAIDs is generally safe for most people, chronic use using them regularly over a long period of time can increase the risk of liver damage. For seniors, the liver is already working at a slower pace due to age, so NSAIDs can have a more pronounced negative effect. Liver inflammation, hepatitis, can occur. Liver damage can develop, especially in individuals with existing liver conditions like fatty liver disease or cirrhosis. In some cases, prolonged NSAID use can even lead to liver failure if the damage is severe enough. They may seem harmless, but when used daily, these meds add up. And hey, if you're finding this helpful so far, don't forget to click that subscribe button and hit the bell so you never miss an important health update like this one. Your liver will thank you. This simple, conversational line encourages viewers to subscribe while still keeping the tone light and connected to the topic. Would you like to add any specific call to action or reminder for your audience in your next video? There are several other common medications that might seem harmless at first but can be causing serious liver damage over time, often without obvious symptoms. These drugs can affect liver function in subtle ways, leading to inflammation, enzyme imbalances, or even chronic liver conditions. Antibiotics like amoxicillin clavulanate and erythromycin can cause liver enzyme spikes. Antibiotics are usually prescribed to treat infections, but certain types, like amoxicillin clavulanate, often found in augmentin, and erythromycin, can lead to increased liver enzymes, a sign that the liver is under strain. For many, these spikes are temporary, but for seniors or those with pre-existing liver issues, the elevated enzyme levels can lead to liver damage over time. Antifungal medications, e.g., ketoconazole, have been linked to liver inflammation. Antifungal medications like ketoconazole are used to treat infections caused by fungi, such as athlete's foot or yeast infections. However, these medications can sometimes cause liver inflammation, which in severe cases can lead to hepatitis or liver failure. For those with already compromised liver health, careful monitoring is crucial when using antifungal treatments. Anti-seizure drugs like phenytoin and valproate are processed heavily by the liver. Anti-seizure medications like phenytoin, dilantin, and valproate, Depakote, are essential for managing epilepsy and other seizure disorders, but they're metabolized heavily by the liver. Over time, this can put a lot of stress on the liver, especially in older adults. Prolonged use can increase the risk of liver toxicity or damage, making it essential for patients to have regular liver function tests. Certain heart medications, including amiodarone, can lead to long-term liver injury if not monitored. If you're on any of these, regular blood tests and open conversations with your doctor are key to catching liver stress early. This emphasizes the importance of proactive health care and communication with doctors. It reassures viewers that with regular monitoring, they can catch potential liver issues early and make adjustments to medications before any serious damage occurs. The good news? You're not powerless. Ask your doctor for liver function tests at least once a year if you're on long-term medication. Also, support your liver with a healthy diet, less alcohol, and supplements like milk thistle or omega-3s, but always check with your doctor first. This emphasizes the importance of routine medical checkups and self-care. It encourages viewers to take an active role in their health by requesting liver function tests and making lifestyle changes to support liver health. However, it also makes sure to remind them to consult their doctor first, ensuring safe practices. And most importantly, stay informed. Your liver works hard for you. Give it the care and attention it deserves. If this video helped you, give it a thumbs up, share it with someone you care about, and remember to subscribe for more simple, clear health tips every single week. Stay safe, stay healthy, and I'll see you in the next one.